Student nurse Eileen Noon, student number 2174451. Laura is a 27-year-old first-time mum and first-time admission to hospital 3 days ago with psychosis and hypomania, following a 3-week period of increasing anxiety and inability to cope with motherhood. Laura reports escalation in the disturbance and fluctuations of her mood in the past 2 weeks, from being restless to overactivity. She also reports poor quality and quantity of sleep, lack of nutrition and self-care. Laura has been expressing her breast milk and wishes to continue to do so. Laura presents with persecutory delusions and paranoia, reporting wanting to keep her baby safe and that people are watching everywhere, stating they are all trying to control me. Consequently, Laura spent a lot of money on securing her home prior to admission. Laura's next of kin is her husband Robert, who has become increasingly concerned over Laura's erratic behaviour and has not gone to work in the last 2 weeks, fearing for the safety of both his wife and child. Laura's mother Catherine has been helping out at home, but the relationship between Catherine and her son-in-law Robert is estranged. Catherine openly criticises Robert and his attitude to Laura's illness when she speaks to nursing staff on her visits to the hospital. Laura subsequently believes it is not necessary for her to be in hospital. However, she reports being happy to stay for 5 days, but then she is going home. This morning, Laura was observed hitting her bedroom window with a chair and shouting she needed to escape despite being on an open ward. De-escalation techniques were used by staff with good effect. The nursing care plan and treatment interventions for Laura are as follows. Laura is a psychiatric emergency and we need to manage her acute symptoms effectively. Our goal is to return Laura to an optimum level of functioning, which could take at least 4 weeks, depending on her response to treatment. Ideally, Laura and her baby should be admitted to a mother and baby unit for specialist perinatal treatment in order to support the development of the mother-infant relationship. However, there are no such units available and Laura has been placed in our care for immediate treatment. We need to remove all hazards and maintain a safe and comfortable environment for Laura. The consultant psychiatrist has carried out an ICD-11 assessment and has diagnosed Laura with psychosis and hypomania. We need to monitor and assess Laura for risk using our clinical judgment and assessment tools as agreed with the MDT. Any sudden behavioural changes in Laura may indicate risk and nursing staff should raise concerns with the MDT and act accordingly. Laura should be advised to contact nursing staff if she experiences any suicidal ideations and or thoughts of self-harm to self or others, especially her baby, which include plan or intent. We need to risk assess for self-neglect, abuse, exploitation from or to others, risk due to impulsive behaviour or disinhibition, medical risk such as developing mastitis while breastfeeding or absconsion. Nursing staff need to establish a therapeutic rapport with Laura and provide integrated and personalised nursing care, which will include regular one-to-one interactions. In doing so, nursing staff will be able to obtain Laura's trust and an understanding of her mental health needs and other issues, and to assess and stabilise Laura's mental state. We need to discuss and plan with Laura how her symptoms will be monitored, for example by using validated self-report questionnaires such as the Edinburgh Postnatal Depression Scale, patient health questionnaire, Beck's Depression Inventory, Hamilton Anxiety Scale, or Generalised Anxiety Disorder Scale. Laura is to be provided emotional support, which will include the use of active listening skills, therapeutic presence and silence. We need to evaluate Laura's psychosocial stressors, such as the dysfunctional relationship between Laura's mother and her husband. Nursing staff must acknowledge Laura's role in caring for her baby and support her to do this. We need to discuss any concerns that Laura may have regarding her baby and consider further interventions to improve the mother-baby relationship. The possibility of supervised, safe interactions between Laura, her baby and husband may improve everybody's well-being. Nursing intervention will include maintaining Laura's physical health, using a nutritional assessment tool such as SANSI. Also emphasis on hygiene, healthy diet, exercise, mindfulness, relaxation techniques and good daily structure is recommended. It is important for Laura to engage with occupational health to help herself to keep herself busy while in hospital, and with the social worker should she wish to talk about any social or emotional difficulties. The social worker can also help Laura and her family to adjust to changes and challenges in their lives. Nursing staff need to observe and document results of interventions, and if outcomes have not been achieved, we need to reassess, identify what went wrong, what can be improved, and implement new revised goals and reevaluate same accordingly. Nursing staff should tailor their interventions to the needs of Laura, her baby and her family. We must involve Laura, and if she agrees, her husband and family in all decisions about her care and care of her baby. First episode psychosis, CBT and family interventions are recommended to improve coping skills and reduce relapse. We need to provide Laura, her husband and family the necessary information to access specialist expert advice on the risks and benefits of antipsychotic medication while breastfeeding. We need to provide psychoeducation about Laura's illness and how a mental health problem and its treatment might affect parenting. We need to provide Laura and her family the necessary information for services such as support groups to help normalise their experience and reduce feelings of isolation. We need to discuss any additional concerns they may anticipate with regards to planning for the future, including managing fear of relapse, and help and support to make decisions and plan for any future pregnancies. The treatment plan for psychosis and hypomania would include the administration of both antipsychotic medication and mood stabilisers. However, there are risks associated with taking antipsychotic medication in pregnancy and during breastfeeding. We may need to seek advice from a specialist perinatal mental health service for expert advice on the risks and benefits of antipsychotic medication during pregnancy and breastfeeding and the choice of drug with the lowest risk profile. At the moment, Laura wishes to continue to breastfeed and she should be given all the encouragement and support. However, we need to explain the potential risks associated with taking antipsychotic medication when breastfeeding and with stopping some medication in order to breastfeed. We need to discuss other treatment options that would enable Laura to breastfeed if she wishes to do so. Laura should be involved in the choice of her medication after discussing the treatment benefits and side effects, and we need to observe her compliance of same. We need to bear in mind that the medicines and Healthcare Products Regulatory Agency states that mood stabiliser valproate must not be administered for acute or long-term treatment of a mental health problem in women or girls who are planning a pregnancy or pregnant due to risk of developmental abnormalities in the baby. Also, the mood stabiliser lithium is not recommended for women who are breastfeeding because the lithium levels may be high in breast milk and will increase the risk of toxicity for the baby. However, if alternative antipsychotic medication has not been effective, and if lithium or valproate is prescribed to Laura, we need to educate her of the treatment benefits, the side effects, the potential risk of breastfeeding, and the necessary monitoring of her baby for adverse effects. We need to closely monitor effects and side effects of Laura's prescribed medication, which will include QDS observations, regular blood tests such as CBC, blood urea, nitrogen and creatinine, liver function tests, amylase, lipase and lactate. Under Section 2 of the Mental Health Act 2001, Laura is a voluntary patient. However, if she wishes to leave under Section 23(1) of the Mental Health Act, Laura can be detained up to a maximum of 24 hours. During this time frame, Laura will be examined by another consultant psychiatrist, and if he or she is of the opinion that Laura is suffering from a mental health disorder under Section 3, then the psychiatrist responsible for the care and treatment of Laura needs to make an admission on Form 13 under Section 24(2)A.